So this is the last section for this semester CME. So today is mainly talking about cranial nerve examination. So for this section, we will talk about will be divided into 4 parts. The first part is cranial nerve examination. Second part is the motor sphere and the sensory sphere of examination, peripheral nerve examination. And then the third part is cerebellar sign examinations. And the last part is the higher cerebral functions examination. So my part is the cranial nerve examination. So I want to emphasize here, today mainly is about examination. So we cannot include interpretation into this section, because if you want to talk about interpretation, it means like we interpret every single findings. It's impossible to do it within 2 hours. So we mainly to show you how to perform a proper exam, a complete one. Okay. So we start. So there are 12 cranial nerves, right? So the first cranial nerve, set olfactory cranial nerve. I think we do it in a Q&A version. It's easier for me now. So what is the first nerve called? Olfactory nerve. Okay. So before I start showing you how to do it, there are a few things I want to emphasize here. The first thing is, olfactory nerve is not routinely performed. Okay, it's only been done when we only need to do it when there is complaint about disturbance of the smell sensation. For example, hyposmia, anosmia, hyperosmia. Okay, so the second point is we don't, when we want to let patients smell something, that something must be common to everyone. We don't use, must be something like coffee common, peppermint common, vanilla common. But we don't use like, we don't show patients some perfume and ask what is the brand of the perfume. It's not common, right? Okay, this is the second point. And then third point here is, we must always make sure that the patient, the smell channel is not obstructed, or that maybe there's some flues, anything, but make sure the channel is not obstructed. So how we perform? Okay. Firstly, you ask the patient to close his eyes, and then after that, use one of his finger to close one of the nostrils. Either one. Close your one of the nostrils. Close your eyes. Then we give patient to smell something. Can you please take a deep breath? Can you please tell me what does it smell like? Again? Again. Cannot. Maybe it's not too common now. Okay, please change the other side. You must do both sides. Take a deep breath.
Green tea.
Yeah, something is, this is a tea, right? So there's no abnormalities with the olfactory nerve. So this is how we test for the olfactory nerve. Okay. That's all for the first nerve. It's quite simple, right? So now we go for the second part. For those who want to make notes, I'll try to make it into point form so that it's easier for you guys to make notes. My presentation today, I didn't prepare any slides, but I'll do it the way I carry out. Is possible for you to make notes, okay? The second part is your optic nerve. Optic nerves mainly, when you want to test optic nerves, is divided into 4 parts. The first part is to test the visual field. The second part is to test the visual acuity. The third part is to test the color vision, and the fourth part is to test the is to examine the eye by using fundoscope. So I'll start the first one. So the first one, before I start carry out, there are a few points I want to emphasize. First of all, the patient must remove his spectacles. Okay. Second point is standard examination. We use something like a pin with a pin with the end of like something like the red color head pin. Okay. But during clinical practice, we use our finger because we hardly get a pin. Okay. The third point here is I want to emphasize here, this is a very crude method. Okay. When I say crude method, that means it's not precise. So the precise way to examine the visual field is what? Anybody? Actually, it's more to ophthalmology lah.
That machine with a lot of lights.
That one is even more precise. Actually, it's perimetry lah. During ophthalmology cycle, you put your head there and in the round thing. It's actually called Goldman's perimetry. This is the more precise way lah. For junior, you will learn it during your ophthalmology cycle. So how we perform it? First of all, your eye level must same as your patient's eye level. Okay, and after that, you must ask your patient to close his eyes. Can you please close your left eye? Okay, you ask your patient to close his left eye, you close your left eye as well. Okay, then you close your right eye, sorry. And then, on the other hand, the distance, assume this is a finger, right? The distance between the finger you put must be equal distance between the patients and the doctor. You cannot put here, you cannot put here, you must equal distance. Understand me? And then imagine there's a big square. Okay, 1 angle, 2 angle, 3 angle, 4 angle, and this is the center. You move your finger towards the center. From the angle, move to the center. Understand? So we'll do it. Close my eyes. You look at my eyes. Okay. So can you see? Then I'll start moving my finger to the center. You tell me when you can see my finger. Can. Tell me when you can see my finger. I close this eye, okay, it's the same eye, but because I need to move my hand here. Tell me you can see my finger. Can. Okay. You must compare your visual field and the patient's visual field. So in this case, we assume that as a doctor, our visual field is normal. So when the patient say can, then you must ask yourself, can you see it? Okay? And the patient, when you can see it, when the patient cannot see it, that means something wrong with the visual field. Same thing, we'll do it for both sides, and I'll not do it again after a little bit of time. So that's all for visual field. So next part, visual acuity. For visual acuity, I tell you the standard one first. The standard one, the patient should stand 6 meters away from the Snellen chart. Anyone know? But junior know or not? Snellen chart. Snellen chart is the chart with a lot of alphabets. Then the doctor will ask, can you see this line? Can you see this line? Can you see this line? This is called Snellen chart. So let's do it. Let's try. Okay, stand here. I assume Whitehall is Mr. Wong is standing 6 meters away from my abstract Snellen chart. So I ask, can you see this line? Can you see this line? Okay. Usually there are more than 6 lines. Okay. If the patient can see only the first line, the visual acuity is 1/6. If they can see the second line, visual acuity is 2/6. Standard is 6/6. That means the patient can see 6 lines. Then we consider that and we consider the visual acuity is normal. It can be 6/6 or it can be 20/20. In this case, the meter will change to feet. That means 20 feet over 20 feet.
Visual acuity should touch the spectacles.
Visual acuity, the spectacles should intact. I mean, the patient should wear the spectacles because sometimes the patients, it's not only the acuity problem. Sometimes it is due to astigmatism. Sometimes might be due to refraction problem with refraction. So we must ask the patient to wear the spectacles. So this is the standard way. But in the ward, sometimes we cannot get such a big space to carry out this examination. So what we do, usually the easiest object that you can access is newspaper. So usually what we do is we just ask the patient to read out the headline of the newspaper. Let's say, Mr. Wong, can you please read out the headline, please? Yes. So if the patient is able to read out the headline, so we assume, of course, again, this is a very crude method. So we just assume that the visual acuity is normal. This is to test the distance visual acuity. Another part is the near visual acuity.